With the rise of the COVID-19 pandemic, a shift in the educational system has been transitioned to a non-traditional way. In the Philippines, schools have started to adjust their new mode of education towards distance learning. Although online learning is an opportunity to those with access, lack of social teacher-student presence and inability to observe demonstrations personally can affect the overall student growth in their chosen course. Good day, ladies and gentlemen. My name is Rafaela Orian.
I'm Rakshadi Pampliega.
I am Trina Pasqua.
And I am Freddy F. Pilar Jr.
I'm Lucia Rabaton.
And today we will be discussing our research study entitled Lived Experiences of LaSalle Nursing Students Towards Distance Learning. As you all know, online learning is an opportunity to those with access, but lack of social interaction, student presence, and inability to observe demonstration personally can affect the overall student growth in his or her chosen course. Although perspectives and knowledge attainability play a role in quality education, this study does not relate to the significance, and that is why we want to know the holistic status of a student.
For the objectives of this study, it is to recognize the thoughts of student nurses towards distance learning, to identify the different coping mechanisms of each respondent regarding to the new mode of learning, and to point out the challenges encountered by student nurses during distance learning. For the participants of the study, 7 College of Nursing students from the University of St. LaSalle, Bacolod will be the potential participants. The purposive sampling was utilized in such a way that the researchers made use of the class list to select potential participants from each year level. The researchers made use of the purposive sampling technique, otherwise judgment or subjective sampling, wherein it depends on the researcher's opinion when selecting the respondents.
For the research design descriptive phenomenological can help researchers portray a clear and realistic narrative of the student's experience. It establishes the research participants' own thoughts and perceptions about the stated topic.
As for the research instrument interview guide consists of 2 sections. Part 1 will gather the needed data for the first, second, and third year level based on students' profiles such as age, sex, device used during distance learning, type of residence, and connectivity status. And the part 2 will consist of lived experiences among the first, second, and third year Lasayan nursing students such as respondents' coping mechanisms, challenges, and perceptions regarding online learning as a mode of education.
For the results and discussions, a theme that emerged is that distance learning has its advantages and disadvantages in this time of pandemic. Significant statements include disadvantage and advantage. It also emphasizes that the synchronous classes provide advantages in terms of live discussions and group projects. On the other hand, disadvantage include issues in regards to a person's accessibility to the learning management system and external factors that contribute to learning ineffectively. Another theme that emerged is that distance learners make use of time management and other forms of coping mechanisms during distance learning. Significant statements include time management, social activities, academic break, self care, family bonding, time, and sleep. Coping mechanisms vary from each participant, although time management was frequently mentioned as a way to cope during distance learning. There were 2 participants who coped through social interactions with family and friends. Having ample time of rest after class was also highlighted as one way to cope with distance learning. Lastly, the theme that emerged was that the challenges encountered are concerns that made the respondents experience distress with the new mode of education. Significant statements include connectivity issues, lack of learning tools in the RLE, tons of unnecessary workloads, connectivity issues, power interactions, and network satellite interruptions. The causes such as power disruptions, time differences, and unstable connectivity gives participants academic anxieties in the midst of lecture discussions. These circumstances are considered the causes that give participants academic anxiety.
As for the conclusion, perspectives of research participants towards online learning shows the advantages and disadvantages of online learning. The advantages are the efficient alternative in having classes to follow safety protocols and students have their own pace in terms of doing schoolworks. The disadvantages is it defeats the purpose of nursing practice, the inadequate resources, distractions, language barriers, and lack of physical demonstrations. Next is the coping mechanisms of respondents are proper time management, self-care, academic breaks, sleep, and social interaction. And lastly, the challenges encountered by the student nurses were connectivity issues, lack of learning tools, and time zone difference.
As for the recommendation, basing on the results and discussion, the USLS administration and College of Nursing should foresee and decide the relevant technologies to be utilized and implement inclusion criteria for all students. Next is for Guidance and Evaluation Center. They should organize programs directed for handling stress and stress management programs for all students. Next is for the clinical instructors. It is recommended to understand the perspective of students. Lastly, as for the nursing students, class officers of each section will collate all queries and challenges being experienced by the students in order to present to the college dean and clinical instructors. Lastly, managing time effectively is essential to improve academic performance. These are our references.
Thank you for actively listening to our research study entitled Lived Experiences of LaSalle Nursing Students Towards Distance Learning.